Why do silicone implants cause capsular contracture? Imagine getting a breast implant and then facing a hard, tight feeling around it. That's what happens in capsular contracture. This condition occurs when the scar tissue that normally forms around a breast implant becomes abnormally thick, hard, and tight, squeezing the implant and sometimes causing discomfort or distortion. The main reason behind this is how the body reacts to the silicone implant as a foreign object. When the implant is placed, the body naturally forms a fibrous capsule around it to protect itself. Usually, this capsule is soft and flexible, but in some cases, an exaggerated inflammatory response causes the body to produce too much collagen and fibrosis, making the capsule thick and rigid. This overreaction is a part of the body's attempt to isolate what it perceives as a threat, but it can turn problematic when it becomes excessive. Another key factor involves bacteria that may be present during or after surgery. These bacteria, often a type called Staphylococcus epidermidis, can stick to the surface of the implant and from a biofilm, a slimy protective layer that shields bacteria from the immune system and antibiotics. This persistent, low-grade infection keeps the immune system activated, leading to ongoing inflammation. The body's response to this chronic inflammation is to produce more scar tissue, which can cause the capsule to thicken and contract around the implant. Studies have shown that when bacteria are involved, the chances of contracture increase, making this a significant factor in understanding why it happens. If a silicone implant ruptures, the silicone gel can leak into the surrounding tissues. This leakage irritates the tissue and triggers a chronic inflammatory response, which can further promote fibrosis and lead to capsular contracture. This is especially true if the rupture goes unnoticed for a long time. Surgical factors also play a role: how the implant is placed, whether under the muscle or over it, and the surface texture of the implant itself. For example, placing implants under the muscle and choosing textured surfaces tend to lower the risk of contracture, because they promote better tissue integration and reduce movement that might irritate the capsule. Patient-specific factors are important too. Smoking and previous radiation therapy to the breast can impair normal healing and increase inflammation, raising the likelihood of capsular contracture. Some individuals may also have a genetic tendency to form excessive scar tissue, which can contribute to the problem. In summary, silicone implants can cause capsular contracture mainly because of the body's complex inflammatory and fibrotic response to the foreign material. Bacterial contamination, implant rupture, surgical technique, and individual patient factors all influence how the scar tissue forms and tightens around the implant. Understanding these mechanisms helps plastic surgeons choose the best techniques and implant types to reduce the risk of this common complication. If you're considering breast augmentation, it's always best to discuss these factors with a qualified surgeon who can tailor the approach to your unique needs.